In 2020, right after Mardi Gras, we had a huge outbreak in New Orleans. We had a lot of patients in the ICU, and although the initial part with COVID was all respiratory and cardiac and other systems, neurologically, a lot of people had what we call encephalopathy, which is patients were confused, delirious, and especially in the ICU, normal brain waves should be somewhere in the range of 8.5 to 12. Most people have around 11 or 12, and the patients in the ICU typically had somewhere like 2 or 3, which is extremely slow, which tells you how severe the dysfunction was. The delayed effects is something we are seeing more and more now. And this is particularly concerning because it's a slowing of the cognitive function, and it seems to affect mostly women and adolescents or young adults. And it can last a long period of time. I personally know of colleagues and friends who've actually had the infection. And the infection itself is very mild and nobody was hospitalized, but the delayed effect is what is crippling them at this point. We are still learning a lot about the virus, but what we know is this is happening in some people, not everyone, and typically with those who have had a milder infection and did not, need hospitalization. So again, that brings up the important point of testing and knowing infections and ideally prevention so that you don't get infected. So viruses in general have been around forever, but the unique nature of this coronavirus, which causes the COVID-19, the impact has been global. And as a physician, my first intent is do no harm, and any life lost, it deeply hurts. So, the number of lives we've lost is, unthinkable. Going forward, our goal should be no lives lost with a preventable disease. That's the key here. Testing has to be more accessible until the population is almost completely vaccinated. I mean, nothing was going to be 100%, but you're talking more than 75%, close to 80 to 90% vaccinated population. But until then, testing has to be available side by side because there will be people who are not vaccinated and exposed, then the testing has to be accessible, otherwise they're not going to get tested, and then they end up having the COVID and end up in the hospital with all the attached costs that goes with that. And caring for anyone with any complex disease is way more expensive than just testing or vaccinating. With neurology specifically, since we are seeing these long haulers, there are implications in terms of we have to now expand our teaching repertoire to include specific clinics which caters to patients who've recovered and are going through these symptoms. And here at Morehouse School of Medicine also, I do plan to have similar clinics for neurology, and as I'm sure other specialties are considering the same options, because we have to learn and teach students, residents, and all other healthcare professionals how to deal with this. As a neurologist, I would definitely state this, that if people after recovering from COVID do experience symptoms that they consider cognitive slowing, the brain fog, long haul symptoms, or any neurological symptoms for that matter, some people even have persistence of lack of smell and taste even after they recover. Any of these symptoms, please reach out to your primary care physician or neurologist. We are here to help.